Hi, I'm Jamie, physiotherapist at One-to-One Wellness Center. Today I'm going to demonstrate the thoracic spine dissociation exercise. This is a good chair exercise. What it does is help improve neck and spinal motion, especially in a rotational pattern. Okay, so we call it dissociation because your neck and your spine should be able to move in separate directions. When we get injured or when we get pain, sometimes they co-contract and they move together, and we want to break that pattern with this particular exercise. I like to think of it in 3 stages. So the first stage, what I want to do is sit a little closer to the edge of my chair so I have a little freedom of movement with my hips. So if they just want to go off in a certain direction, allow that movement. We want to move as effortless as possible with as little muscle contraction as possible. You don't want to feel like you're working, and you don't want to push into stretcher pain as well. Okay? So one hand just rests at my side. The other hand, I'm just going to rest on my chest or my opposite shoulder. This hand here is basically pointing in the direction that I always want my thoracic spine to move. So for me, I'm going to be moving to my left on this exercise. Okay, so all 3 stages we're going to do to the left, and then we'll switch and do all 3 stages to the right. Okay, so first one is I slowly let my neck drift to the left, and then my spine will eventually follow that, and I relax down through my hips and my abdominals. And I get there effortlessly, but right here that feels as far as I can go without having to push or work. So I'm not going to go beyond that. I pause for a second or 2, and I slowly come back to the center, and I just rest for a second and turn my muscles off. I'm going to repeat that anywhere between 3 to 5 times. Slowly and cautiously moving out. So I have lots of time to feel at what point does that stop being effortless. Then I just slowly come back to the center. So we don't want to alert your nervous system to any kind of stretch or discomfort, so move nice and cautious and slow. And again, slowly rotate out. And slowly come back to the center and rest. Now the second component, we slowly go out to our tension point right there, and I'm going to leave my thoracic spine there. Then I'm going to move my neck in the opposite direction. As I try to look over my right shoulder, I feel the muscles in my right neck working a little bit. They're contracting, but there's no pain or discomfort. Then I just slowly bring it back, and I look over my left shoulder for 2 or 3 seconds, leaving my trunk there, and I slowly come back over the right, and then slowly back to the left, relaxing through my hips and my abdominals too. My knees may flop over to the left, and that's okay. And coming back to the middle after about 3 to 5 reps. What you might note is that's hard to turn my head in the opposite direction. I feel like I'm contracting muscles and having to work a little bit. But as I come back this way and I'm relaxing through my lower half, my thoracic spine, as my head goes left, might even shift slightly further into left rotation. So you'll gain a little bit of range in trunk rotation bit by bit each rep. Okay? And the last component is doing 2 things at once, so this can be a little confusing and take a little coordination, but this time my trunk is still going to the left, but at the same time I'm going to look over my right shoulder. I take up the slack there, pause for a second or 2, and back to neutral and relax. Slowly turn my trunk left, but my head right at the same time. And then they both come back to the midline and rest. And then I'm just going to repeat all of that to the other side. This hand would then be on the right shoulder. I would start by neck and trunk going in the right direction, leave my trunk to the right, and then look over each shoulder back and forth. And then the third component, trunk goes right, head goes left. Okay, so that's thoracic spine dissociation.